This is Dr Rachel Sutherland. I am the Chair for Careers on the Royal College of Physicians of Edinburgh Trainees and Members Committee. I'm an ST7 in Acute, General and Stroke Medicine. And today I'm having a discussion with Dr Felicity Baines, who is a Foundation Year 1 trainee at the Borders General Hospital. Every year, we as a committee create an evening medical update, which is top tips for Foundation Year trainees who are about to begin their rotations. And so the idea of this podcast is that Felicity and I are going to have a chat through things that we think would be helpful for the folk who are medical students who are being deployed early, effectively beginning their FY1 year a bit sooner than they should do. So thanks very much, Felicity, for joining me today. So, Felicity, tell me a little bit about yourself. You're a Foundation Year 1 trainee, that's all I've told them. So.
Yes, yeah. So, an FY1, started working the Borders, my first rotation, general surgery, stayed here for general medicine and have subsequently stayed on since everything has happened with COVID.
Yeah. So the COVID pandemic, you were meant to rotate somewhere else,
yeah,
is that
I was
right?
meant to move to Edinburgh.
Yeah.
So, to cardiology over there, but everybody's at a standstill at the moment. So it's quite nice being stuck somewhere that you know how it works. Yeah. And I think that's probably very useful at the moment. But
it's kind of good that during everything being changed, actually you're somewhere, some familiar faces, you know, that side of things is incredibly helpful and important. You start to realise how important teamwork is, isn't it?
Absolutely.
So, as I said at the beginning of this, one of the things I wanted to talk through with you, because I'm a really old bird now, as I said, I'm an ST7, and being an ST7 means I've forgotten a lot about what being an FY1 is, and actually Foundation years have changed a lot since I did it, in 2006, and technology's come on. So my first question's really about the things that I would advise people to prepare and download onto their smartphones.
Okay.
Are there things that you found particularly useful in your daily practice as an FY1 that you've used your phone for? Yeah,
so I think it will probably depend which hospital you're in, but certainly for the Borders here we have like an antimicrobial app, which is really useful for looking at what's on the formulary, which medications you want to prescribe. It's also got the vancomycin and gentamicin dosage calculator, so you don't have to find a computer to do it, you can just do it all from your phone, which is really handy to have that.
Yeah. So there's MicroGuide that you can use for other centres, which is a similar app. But yeah, knowing what your local unit uses is probably the most helpful thing. But a MicroGuide or micro app, that's one of the things you've probably used on a daily basis, would you say? Yeah. I also recently found the induction app. Have you used that at all?
Yes, the induction app is really helpful. So it's an app whereby you've got basically all of the numbers that you need for your establishment, so bleeps, numbers to direct wards, so and for specific doctors. So if you know you need to contact somebody, you can just look at your phone again and get that number and not have to go through switchboard.
Yeah, I've had a few of my friends who are radiology trainees that were like, why am I getting all these phone numbers through at the moment? And I'm like, that might be that's gone on the induction app, because you can actually put numbers in there yourself as well, can't you? That's a nice thing. Right. That's a nice feature of the induction app. And you can switch it for different hospitals. So even though I've moved around quite a lot, you know, I can change it for, say, Edinburgh Royal or the Western General, or even Bolton or Blackburn, or so
it's all over the UK.
It's all over the UK, yeah. And because people edit it themselves, you can upgrade numbers that are
up to date. Yeah.
So the induction app's another one that I found really helpful. Anything else that you have on your phone that you use?
There is another one that's called Spot. Don't know if you've heard about it.
I haven't heard about Spot. I'm learning things here as well. This is great.
Yeah, so it's actually it's more designed to help you prescribe opiates and the conversion between different types of painkillers that you might give to people. So it's quite specific, but it's very good because it makes you work through the calculations and tells you if your calculations are correct at the end. So it's safe prescribing of opiates.
That's really good. So if you're on, say, buprenorphine patch and you want to convert that, you can pop that all into Spot and it will tell you what
you have to do all the calculations yourself, so you still need to know the working through, but you put it all through this app and then it will say whether or not well, yeah, it just comes up as a red if you're completely wrong, and that's an unsafe thing to do. And if it's green, you know that you've done your calculation correctly and you can prescribe it.
That's pretty good. So it actually helps you do the actual process of the calculation. Because there's often situations when you're on nights or things like that that you might be... you might make simple calculation mistakes. So for something to help you,
and I think that's how it was born. Actually, I think it's a GP now who designed it, and it's because when he was a junior doctor, he had, I think, a bit of a mishap with prescribing the incorrect dose of something when he was doing a conversion. So he thought it was very, very useful to have that, and it was sort of the end of a 12-hour shift or something when he made that decision. So
that's really excellent. That's good. I like the BNF as well. I think the BNF can be helpful for... It's much quicker often to search it on your phone than to flick. The books are around all the wards, but sometimes you can't find them, or you know, somebody else is using them, or it's an older. Whereas the one on your phone is the most up to date, isn't it?
Yeah, so, the BNF is great, and you've got the BNF for children as well. I think it's got everything on there, hasn't it?
Yeah. So that's another app, and I think those are the things that I use on a day-to-day basis, and it's kind of good to have downloaded those beforehand and had a flick through and
familiarise yourself with how they work. Yeah, which is good. And the hospitals, I think, are fairly good at induction about and telling you about all of these things that you can use on your phone, because it is, I think, sometimes a bit more specific to where you are and what they like to use.
And I guess being a social media, not that we are as a college in any way endorsing any social media things, but I think that WhatsApp's probably the thing that I use the most. And I know some people don't necessarily want to be on WhatsApp, but for having groups of people, you know, that are on the same rota, or as a communication tool, actually, I think WhatsApp's pretty good.
It's a very useful tool, actually, for that. And before I started, there were 16 of us who were starting in the borders, and we just sent an email around and said who would like to be part of a WhatsApp group. So we'd kind of all touch base with each other before we started, which I think is also quite nice when you're moving somewhere new, starting a new job, and it's just less daunting if you know you've already made some contacts, even if it's only over a phone.
Yeah. And I guess the folk that are doing these medical students that are being brought in early, they will go through a formal induction. And I guess what we're talking about are just those helpful hints and tips of things that, you know, we would like to do for them, or they might find useful from, you know, for when they start. I found it really helpful before I started to have a walk around the hospital.
Yes.
And to go to each of the areas, even if I wasn't working in, say, I don't know, ophthalmology, that I knew where it physically was. So I spent a bit of time looking at a wall planner, because I like a map. But a lot of people don't, but it's difficult if you're rushing places to get lost when you start. So
definitely,
I spent a day wandering around, finding where the canteen is. That's always important.
Yeah, that is a good one. You need to know where to get your snacks and supplies from.
The good coffee place, that's the other key thing, I think. You know, like in certain hospitals, you know, some places do better coffee than others.
Yes, don't have that issue down here. Really.
No, it's only one place.
Limited, but, I can imagine in the larger hospitals that's what you need to do. And I think you're exactly right. Actually, I can speak from experience that we didn't really have an induction like that when I started here. It was all a bit haphazard, and it certainly took a while, even though it's not particularly large, to really get to grips with where everything was. So I think it's well worth your time wandering around, as you say, having a look at the floor plan, seeing where everything is. And you can sort of find the little quick ways through as well, because for a long time I used to take convoluted routes to get to all of the wards, and then you realise that there are some hidden secret doors just for staff that you can try and nip through. So,
you walk with a senior registrar and you're like, oh right, I'll not fess up to the fact that I've been walking a really ridiculous route.
It even happened to me today. I found a new way into outpatients. So it's always good to have a good look around.
And I think for the bigger tertiary centres that I've worked in, I think that's even more important, because you can actually get your step count up by getting lost quite significantly, can't you? And on nights as well, things look different, you know, and different routes are closed.
So. And you probably cover different areas, you know, like as I say, I started on surgery, so we were pretty much confined just to the top floor and 2 wards. Like, you didn't really go anywhere else. But then on nights, you're the whole hospital. So if you just get bleeped by somebody and say, oh, I need you to go to so-and-so, you need to know where that is in case it is obviously emergency.
So orientating yourself sort of almost before you start, taking that time, it's kind of time spent in reconnaissance is never wasted, is my kind of take on it. And my other piece of advice, this is from me, is plenty of pens. Have a stash of pens.
Yes. Not just because they get stolen or nicked by other people. You actually just write a lot. Especially here, we're not on electronic track, so you will go through a lot of ink. And so I really wanted a nice pen to start with, and realised that was a futile way to start as well. You just need biros.
Bics,
just go through them.
Absolutely.
Exponential rate.
Yeah, I like the soft tip. You get to know a pen that you like. Yeah. And there's a lot of places that are all electronic, so there's fewer and fewer places that are writing in notes. But many places still have written prescription charts, for example.
Yes.
And you need a black pen for those. So have a stock of black pens. When I started my last job, I had a notebook with a piece of paper, with a pen that clipped together so that I could keep a jobs list. Because I think for an FY1, your jobs list is really your... And some places that I've worked have had electronic jobs lists that they've kept on a laptop, which is a roving jobs list. Yeah. But actually, you still need a personal one, and most people use pen and ink for that. So
I think people have different ways of sort of keeping on top of things, but I certainly find it easier to retain and remember what I need to do if I've put pen on paper rather than typed it anywhere. But again, people develop their own sort of way of working. So in surgery, we had a jobs list on the computer, but we printed it off every day so people could then add to it and annotate it as they went when you do the sort of handover in the morning. But on medicine, it's jobs books as well, so it's in sort of a centralised book that everybody can access, but you can add to it, and that's quite handy as well.
And they're kind of communal jobs, and then that can evolve as it goes along. Yeah, absolutely. I know some places now have them, on smartphones, so you get pinged jobs and stuff like that. Yeah, but I think for most people, you need to just have the confidence to develop your own system. I think that's the message. I used to print out a map of the ward, like you can do here, a floor plan, and then I would have it looked chaotic to other people.
But to yourself, it actually makes a lot of sense. And I think you're right. It's whatever works for you, and as long as you're taking responsibility for the jobs that you need to do, and if you can, it's however you feel comfortable doing with that.
So I think pens and your own personal mechanism of how you're going to record your jobs list so that you can have and I've seen people just frantically, they've lost their jobs list.
Yes,
Everybody loses their jobs list. That's a bad moment in the day, isn't it? Yeah. And obviously, for me, that stays in the hospital, because obviously we have to make people aware of information governance and that side of things. You don't want to be taking that list that might have patient identifiable information out, so you've got to shred that or put it in the
confidential waste.
Exactly.
At the end of the day, absolutely.
And then I was going to move on to ask you about how you kind of addressed your kind of self-care when you first started. Did you think you were good at it, or do you think you got better?
No, I think I was awful. In total honesty, I think everybody thinks. You're always told, top tips for starting: make sure you have a life outside of medicine, make sure you look after yourself and you see family and you do things. I think, the first month is an adjustment. It is quite difficult. It's unlike anything you're ever really going to ever experience, because you're used to life as a medical student, and then all of a sudden you have the responsibility and you have to be there for your shifts, and sometimes you're not that well supported. You might have good support until 5 o'clock, and then you're there 5 to 9, and it's very, very chaotic. I found that I was kind of tied to the ward for a while, until I realised that that's the whole point of bleeps. You can leave, and it's okay to leave, as long as you're not, you communicate with everybody that you're off having a break. But I think that's quite an important thing to do when you start work, is making sure that you do take your breaks, and I think leave the ward is actually quite an important thing. Don't take your break in the doctor's office on your ward. Take it away from it so that you actually get a bit of a mental break as well. Because even if you say you're having a break, there will always be interruptions because there's always something happening.
They can manage for 30 minutes.
Yeah.
The nurses have a 30-minute break that is covered where people leave, and actually we need to actually model that as well, I think.
Yes, definitely. Yeah, we can learn quite a lot from them, actually.
Yeah.
I
always say to people, try, especially in the summer months, like it's rubbish in winter if it's raining and it's cold and it's miserable, but actually try and get out and see a bit of sunshine. It actually makes a big difference.
Get some vitamin D.
Yeah, absolutely.
I think that's a useful thing to know. If you have a good office, I was fortunate, we had an office with 2 windows.
Yeah.
So actually, even when you were doing long shifts and it was going dark at 4 p.m,
you had
still
a relationship.
Had a bit of sunshine.
Yeah.
Or at the pokier parts of the hospital where it's pretty miserable in the winter. But thankfully, they're starting at quite a good time.
Yeah.
At the moment, it's getting lighter and brighter.
Absolutely.
And longer days.
And what about things like, a lot more people, like you're sat here with your Chili's water bottle.
Yeah.
And I've got one too. And when I started, there wasn't really the culture of having a fluid jar with you. And actually, you get quite dry.
Yeah, absolutely. I'm sure I was extremely dehydrated for the first few weeks of work. You just sort of get a bit overwhelmed, I think, with jobs and what you're doing, and you'll think, I don't have time to go to the toilet, or I don't have time to go and get a glass of water, or you thought about it and then 3 hours later you realise that you still haven't had anything to drink. So it's quite handy having your own bottle with you, because it just reminds you, I think, more than anything, when you sit down to do your job, you can have a swig.
And you will have a little space that you will cultivate, usually in the doctor's office, so there is somewhere that you can put that down. Yeah. There's usually a water cooler somewhere on the wall that you can fill it up
there
from.
Is always, cold water supply nearby, which is good.
And something that I, get in the habit of it now, because otherwise it costs you a fortune. So when we recently moved from one area to another, and there was a Marks and Spencer's food hall in the hospital. Yeah, it cost us a fortune. Actually,
amazing.
You can't go to Marks and Spencer's every day and buy your food. Well, of course you can, but it will eat into your. You will notice the amount of money if you're spending £5 on your lunch every day. That's £25 a week. Blah blah blah.
And that's just your lunch.
And that is
if
just
you're staying for your dinner as well, and your coffee. So
coffee. Yeah, that's the other thing. So actually, probably when you come, I remember the first month of work I was absolutely skint, because you're waiting for your paycheck and blah blah blah. But actually, getting into the habit of making homemade food, and it's something you like. Something there is always somewhere on a ward for you to put your food, and store it, and then you can eat that.
It pays to be very organised, I think, from that side of things. I'm still quite bad.
Me too.
Making sure that I can, I've prepped enough for the week ahead. But when you do the really long days, the last thing, you do end up having to be organised about what you're eating, because it's important to make sure that you're drinking enough, but you're also eating enough to keep yourself going,
and eating good food. The canteen is not the place for healthy food choices. And we work in a hospital, and I think I ate my own body weight in chips and beans when I first started, and actually it's not good for you.
Well, I went into the canteen the other day and said, "Where are the vegetables?" And they said, "We've got chips." I'm not sure that's the definition of one, but
so having investing in yourself, really, to have a healthy meal. I know so many of my friends, me included, piled on weight when I started work, and it was because I wasn't making those good food choices. One of my friends, I used to giggle at her, but she had the same sandwich every day, and we used to joke, if she was a diabetic, she would know exactly the amount of insulin that she needed to take. But actually, that habitual, I'm making this sandwich, it's nutritious, I know what's in it, with a little packed lunch, it has a lot of merit to it. I think if you can develop those habits early and not get into my
don't
cost
bad habits. Like I've got bad habits.
So we've kind of covered about some of the logistics, so the apps. We've also talked about logistics of the actual place you're working. We've talked a bit about self-care and sort of saving yourself money. And I guess I just would like to ask about some of the nitty-gritty of actually on the job, sort of, being an actual FY1, because it's so long ago that I can't remember now. So is there anything in terms of the day-to-day work, working within the teams, that when you start, you wish you'd have known before you started?
I think, to be honest, just a really important thing to remember is to not be shy and make sure that you're proactive about things. And if you have any questions, don't be afraid to ask anyone. Like, there is always somebody there who will help you out and support you. And actually other F1s to get, like, you're in it together, so you can always bounce off each other. But the nursing staff are actually really, really great, and I relied on them so much at the beginning, especially somewhere like surgery. I wasn't particularly confident with things like prescribing a lot of sort of heavy duty pain relief for surgical patients. So I was sort of going very slow and low doses with things, and actually taking advice from people who've been working around it for years. They know a lot. So I think just make sure you sort of take everybody else's points of view on board, and don't be afraid to ask any questions.
I think one of the things that I would sort of reflect as now a senior person to people is, if somebody is rude or unkind or dismissive of you, I don't think that's on you.
Yeah.
And I think that's really difficult when you start, because this is the start of your job. You know, like you say, this is a transition, this is your first job.
Yeah.
So you go into it and you do take everything incredibly personally.
Yeah.
But actually, if somebody behaves badly, that's their behaviour. It's not necessarily in reference to you.
Yeah, I think that's
they're
fair.
not coping. Yeah. When you are at different points in your career, which you'll appreciate as you get older, you know, so when you every bit where you step up is a stress point. So when you move from FY2 into your specialty, when you move to become a registrar, when you become a consultant, and all of those things happen in this August changeover.
Yeah.
And so that's often quite a mixing pot of actually people not coping or finding it difficult to inhabit that change.
Yeah.
And so sometimes, you know, when somebody is short or rude, or, you know, that's actually a reflection more on them and the circumstance rather than you personally.
Yeah, no, I think that's completely fair. And try not to take things too personally, because it's an adjustment for everyone, actually, when you start. And most people are just trying to do the very best that they can do, but it will be, I think, probably at least a month of trying to get used to what your day-to-day life is, and just sort of navigating new work. Yeah. But it's good to feel part of a team, and I've certainly felt that here. I think it's been a very supportive environment. I think it's one of the benefits, actually, from a district general point of view. You get to know quite a lot of the staff at all levels, so you feel safe in lots of ways and feel like you can ask lots of questions, even if they do seem a bit silly. And I think as long as you try and you've shown some sort of initiative, most people are actually all right, and will try and help you out.
We were just talking to a colleague about this not so long ago, and we were saying that the proactive thing shows itself in things like people will go, oh, this patient's really difficult to cannulate. Yeah. And if you go straight to the reg and go, oh, would you cannulate this person because they're really difficult to cannulate? And you haven't actually had a go. Now, I've heard people sort of argue the opposite to that, go, oh, you don't want them to ruin the one good vein or whatever. But actually, you can always ask for somebody to come with you.
Yeah. You know, and help you out, and because that's the only way you'll learn as well, by seeing where they go through. So yeah, definitely. And
by definition, the cannulas and bloods you're doing, especially nowadays because of the the widespread phlebotomy service, lots of nurses can do things. Yeah, you are doing the difficult ones. Yeah. And the people that helped me most with that were the hand nurses, actually. When I started, I thought that the hospital at night team, for those of you who don't know what hand means, they're people, who are used to dealing with the tricky stuff that comes up in the night time, and they're great problem solvers. Yeah. And I used to, if we got quiet tonight, to just go around with them and do some cannulations. Practice. And it's actually really important, I think, to not shy away from it. You can, because you will have some bad days and like high failure rates of putting cannulas in, but you need to just keep trying, because you will just get better with time. Yeah. I think as well it's important, when we're talking about like communication and teamwork, or like asking for help. Sometimes I think as a junior doctor you can be left with some jobs or difficult tasks that you're not really sure why you're doing it. So like referrals to other specialities, or like requesting a CT scan, but you're not quite sure
why you're doing it.
Yeah, especially in surgery.
Especially in surgery.
Not surgeon bashing, but but I am kind of, I remember those days well, like, why do I want these 27 CT abdomens?
And then when you get a phone call from the radiologist, because it's your name on the request, it's not great. So I think it's actually always really important to think about it yourself, like anyway, like what's been going on with the patient, and try and sort of gather as much information as possible. But then it's also entirely appropriate to ask your senior why they're doing what they're doing, and it can feel quite uncomfortable, I think, when you first start, because you want to feel like you're doing a really good job, and I'll do that job, don't worry, I'll request this, but actually you need to know a bit more sometimes. So I think it's important to just kind of keep clear, like open lines of communication with everyone, and not be afraid to ask
or clarify a way of can I just clarify, because I'm just putting I always used to frame it in that way, like I'm just filling in this CT request and I just wanted to clarify what's the question we're asking. And
another thing for like referrals is don't make a referral unless you have seen the patient yourself. That can be that's one that you might go on the ward round and the consultant says, this person needs an orthopedic review or an ophthalmology review. You need to make sure you've examined whichever joint or the eye and done something before you ring that specialty and say, can you come and review them?
Or observe the examination, because it might be your consultant that examines them on the ward round. But you need to
make sure you've got all the information before you make any sort of requests. So I can speak from experience.
The PR exam is a classic.
Definitely.
So have you examined them? No, that's terrible. That's a bad moment for everybody involved. I was just reflecting that, when I started, the SBAR structure had come in, which is situation, background, assessment, recommendation. And actually that's a structured way of putting in, you can use that for a lot of things like requests. The situation is that there's a 37-year-old that's come in with abdominal pain. The background is they've had chronic issues with abdominal pain. My assessment is they've got a rigid abdomen and I'm concerned, and my recommendation is we'd like imaging to determine if this is an obstruction, blah, blah, blah. And actually, you don't have to put S-bar in there, but that's just a checker for, have I got...
you've not missed anything. And it does make a lot of sense. They're really handy tools to use, actually, I think, all the time in medicine. When you're chatting to colleagues about what's been going on with the patient, when you're handing over to the night team, they're really handy.
And I always think it's worthwhile I always used to take 10 to 15 minutes at the beginning and at the end of the day. So I used to go to the nursing handovers when I first started, because actually you get this real feel. The nurses, might give you some of the softer information. I was washing Kitty this morning and she seemed a little bit confused. And actually I picked up a number of rumbling deliriums from understanding what the nursing teams were doing, or just centering yourself, knowing your patients that you are responsible for. I think, when people then ask you questions, you can counter, she was a little bit delirious last week, but actually that does seem to be resolving and this is different. You only get that subtlety from really knowing your patients, and that takes time, And
also, like if you spend time with the nurses, or you have little sort of meetings or MDTs, like it's actually a really good opportunity to see the bigger picture of what's going on with all of your patients.
My big piece of advice is that the NHS runs on caffeine. So know your consultant and know what they drink, either tea or coffee, and your registrar and your SHO. But those we used to go for midway through the ward round. My consultant said he'd got long enough in the tooth that he couldn't concentrate for more than 8 patients. So we'd do 2 bays, and then we would go and visit Mrs. Brown, which was a cup of coffee. And actually we'd come back and finish the ward round, and we were all refreshed. But I've had consultants that don't drink caffeinated drinks, so they have peppermint tea or whatever. But actually those coffees, those touch points are really incredibly important. So do not ever decline a coffee. Think, I'll just get these jobs done on the ward. You'll be quicker
having a break and then going back. And I think sometimes because I think all doctors work differently, and I've certainly been on some ward rounds that have lasted about 5 hours without a break. So I think it's also okay in those situations to excuse yourself sometimes, not to like go for a coffee or whatever, but just make sure that you're like, sorry, can I just nip out and grab a glass of water, because they can feel quite long. and you do lose concentration, so it's quite good just to have a bit of a quick breather somewhere.
Yeah. And I think that those softer times are the things that I still remember, like the cups of coffees, the somebody going, do you know what, just go and get a bit of fresh air. Like, I was a terrible fainter when I started. I used to faint on really long ward rounds or during long surgical procedures. That's why I'm not a surgeon.
That and lots of other reasons.
Many other reasons. But you need to pay attention to, those softer things are built in for a reason, is what I would say.
Yeah, definitely.
My other pointer is that get to know different people's way of working.
Yes.
So we all aspire to an evidence-based medicine practice and to relay, the most up-to-date clinical evidence into practice. But there are still subtleties into how people enact that evidence-based medicine. Yeah. That's an incredibly politically correct way of saying people do things very differently. And you as a junior can sometimes be at the butt of that. So you might have a consultant that, they're doing off and on weeks for wards, and they will take over patient care and then change things.
Yes.
That happens. Yes, and that's just about the way people are translating their behaviours. And again, one of the best doctors I know, she worked in a unit and she amalgamated everybody's good points. Yeah. So there were, say, 6 different consultants, and she amalgamated all their good points and learnt from all their bad points. Yes, and that was the way she became the best consultant. Yeah. And actually, even if you think you're observing people that aren't, the best communicators, or that might not be their skill set, but learn the things you don't want to do as well as the things you do want to do.
No, so you can always learn lots of things, I think. From everyone that you work with, and in every ward it'll be different.
And learn from yourself. You do change over time. You do realise how you want to practice, or there'll be people you will not get on with. They just will be different people to you, but it doesn't mean you can't still work with them for positive outcomes for the patients. And that's something, thus far in your life you've often had a lot more choice, I think. Or as a med student, you are a little bit at the mercy of some of the folk that teach you, but actually in the working environment, you're only there for 4 months. You've only got that person for 4 months, so use it as a learning opportunity about them and yourself. But I have to say, most of my experiences were incredibly positive and supportive.
I would say from my limited experience so far, it's been I've really enjoyed it. And as you're saying about like having those coffee breaks and spending time with people that you work with, actually that's really nice as well, for it not to always just be about the medicine and doing the jobs. Like it makes work a lot more enjoyable. Having those sides of things. And I think, speaking about sort of like reflecting on everything, I think every day is this constant reflection in medicine. One thing that you should always try and do is make sure you keep your portfolio up to date. Because that's something in training that if you leave that to the last minute, you can find yourself in a bit of a pickle.
I think a lot of deaneries have moved away as well from, everybody used to do it at the end. It's a universally acknowledged fact. They introduced it and it was seen to be, this is a good idea. But deaneries are now moving towards, you have to show progressive engagement with portfolios. And I don't think that should be a stick that's beating you. But I think engagement with that reflective process just shows your growth and development as a doctor. And I think the fact that we haven't had an interview process this year for a lot of specialties, people are having to lean back on, the things that have filled their application form, and that comes from that work that you put in. So it isn't unimportant. I think I think if you do a little as you go along, it means it's a lot easier.
Definitely.
And also the points of the portfolio. So we're all overachievers in medicine. We are all, by definition, people who are, highly skilled, intelligent people. That's what the selection process is to get into medicine. And I think people find it really difficult to deal with, at the beginning, you won't be as good as cannulas, at cannulas, as you are at the end. But having evidence to show that you've progressed that is powerful, and it shows yourself your own progression, so to speak. So
that's true.
Don't open your portfolio in November.
Yes, definitely don't do that.
We've all got a friend that's done that.
I'm a last minute person. But no, with portfolio, I think it's important that you keep on top of it. And actually, as we were saying earlier, everybody does work differently. So for me, I'm not great at putting it straight onto the computer. So I actually have a notebook that I have written things in as and when I've been to a teaching session or seen something that I've thought about for a while, and I'll just document it there. And so I leave it to the last minute, and as much as I probably update portfolio a bit later, but it's from that time. And everybody just works a bit differently.
And don't forget your education. So I found I trained in Yorkshire and then doing my foundation in Manchester. Lots of places have different mixing pots. You'll meet new people. But in certain places, people don't move. But think about your education. So this is how I came across the Royal College of Physicians of Edinburgh and the evening medical updates. Because that was, apart from grand rounds, the only times I then went to lectures. And you do have this weird... I found it really weird, that transition. I'm in work all the time, and I was like, I quite miss lectures. And I never thought I would feel like that, but it's like, it's quite nice to sit here in a lecture for an hour, And so think about things that you might want to go to from an educational perspective.
Because I think especially early on in training, it can feel a bit more like service provision, and you're not learning as much as you thought you might. You might be getting better at things like procedures, but even just moving into medicine, because I was based mostly on the elderly ward, which was great because I'm interested in gerries, so I like that, but it was just ward rounds every day, and I actually really missed doing acute surgical admissions and seeing patients and actually parking them in and just doing a bit more medicine. And you have to try and find ways to actually get that from your placement. So you have to be quite proactive, I think. Sometimes it's very easy to just sit back on your laurels and just do the bare minimum. Or become competent at the job side of things, but you actually still need to be progressing. And it's not necessarily academic. Medicine is moving on, and you need to keep a pace with the evidence bases. So I really recommend podcasts. I know we're recording one now, hint, hint. But things like, I like Heart as a podcast. I think they give really good synopsis. The BMJ have a good podcast as well, and they create rapid reviews, that you can access. NICE have a podcast, so, for listening as you're travelling to work. That's especially if you've got a long commute. Down to the borders.
You
can definitely listen to a lot of podcasts.
Absolutely. But, and other podcasts, to broaden your horizon. But but having those things in the background, if you think, actually, I've had a patient and they've had a cardiomyopathy, and actually I don't know a lot about cardiomyopathy, podcasts are a really good way of accessing that. And I also found GP Notebook invaluable as a foundation trainee.
That is good. It's a very good website.
It's a really excellent resource, actually. Fair play to our primary care physician pals. But, I am a secondary care physician, but I do need to understand certain things, and that's a brilliant resource. Up to date, those types of things. But you can log all of those within your reflective practice.
Okay.
And especially as you get further on in your training, CPD, continuing professional development, you can show, I'm reading, and you need to get into the habit of logging that education contact points, because you do it differently to when you're a medical student, where you're invested in it because you've got this exam to pass, and then you might have your membership exams. Again, you're invested in that, but actually then as you get further, you have to be invested in it for your patients and for the development. So it's a good habit, I think, to start early on, is keeping a CPD diary, basically. I also have a doctors.net account? I don't know if
I
you
don't have one. I have heard about them.
Yeah, so that's a good webmail server, but they also have a lot of online education. So there's an education portal. I really recommend them. I found them really helpful, and you can get activated CPD from that.
Oh, that's good.
Yeah, so that and they've got a lot of stuff for sort of foundation trainees.
Oh, okay.
And that kind of
I'll have to probably look at it.
Yeah, they have forums and that kind of thing. That's quite a good community of doctors, and you can find a community of things you might be interested in, or other foundation doctors and that kind of thing. And of course, I'm duty bound to promote the Royal College of Physicians of Edinburgh, but they do have a fantastic educational portal, and again with CPD access. They also have the evening medical updates, which are web streamed to lots of areas around the country. You can come physically to Edinburgh to see it, or you can stream into that. But we also have lots of courses that are available, and symposia, and they give you a rapid day of update in that area. So, there's a geriatrics course, which is 5 days. There's an acute medicine course we've been developing. And once COVID's over, these things might be nice to see see folk at again, but I've found those good throughout my career, so those are things I sort of recommend. And I think finally, to kind of finish off, I think it is really important to maintain a semblance of self outside of medicine.
Yes. Yeah, definitely.
So it's quite all encompassing as when you first start, you're sort of in that zone, but actually, I mean, I played netball at university and then joined a team of people who were doctors who played netball, and that was a real lifeline, actually. It got me out, a day a week. It was different people of different levels who would, say to me, oh, yeah, I remember that. Or, and
I've actually always thought that even at medical school, it was quite important to have things that you do outside of medicine, and friends who are also not probably medically minded, because it's very easy for it to just be your focus. And actually, it's really easy when you're around doctors all the time. Like, I live with another junior doctor, so we now have a bit of a rule that we don't speak about stuff. We have sort of the first 20 minutes when we get home being like, this is what happened today, and what did and that's actually really important, because as you say, you learn a lot of stuff from what's happened at your day at work and things like that. But it's also really important to then park it and do something else. So whether that's like my flatmate, she goes for runs. I play tennis, although currently not part of a tennis club between here and Edinburgh. But yeah, just having hobbies that you can distract yourself with. And I think it's just good for everybody's mental well-being, isn't it?
It doesn't have to be sport, it's sport for me, but just join something else. I've got a lot of friends who knit, crochet, do that, quilt, music. You have the but look for something where you've moved to that is something almost separate that you can join in on, rambling, whatever it is, just
reading. Like, it literally can just
book club, be in a book club or whatever, but just something external to medicine. I would highly recommend that. And you need to be able to switch off at the night time. So I think
sleep hygiene is actually something that is really I've probably changed the most. I suppose we're going back to like self-care and things, but especially when you do nights, and transitioning from nights to days can be really quite tough.
So I would really recommend, I've done a whole podcast on this with Dr Farquhar, who's a sleep specialist down in London. So I would highlight listening to that podcast, and Dr Farquhar has some really good resources. He does a lot with the London Deanery, with the trainees down there, and I think that transitioning from nights to days is it's a fragile time that your sleep can really unravel.
And I think even just with your regular day shifts, like if you've worked 12 and a half hours and by the time you get home, you've been out of the house for 14 hours that day, you're just quite wired when you get home. And it's important, I think, like screen time is actually quite bad because it keeps you going for longer. And I think I've certainly found it quite good just like not to have my phone on me really when I go to bed. I leave it far away from my bed so I'm not tempted.
My husband bought us a disconnect to reconnect box, it's called, and the phones go in it on charge when we go through the door, and that's so that we're not on our phones and we're present with the kids actually, but they stay in there at night time.
Because it's really easy. Like, I'm actually not one for being on my phone that much outside work, but at work, as you're saying, if you've got all these apps on it, you feel like you actually look at it a lot, and it's always there, and it's a bit of a security blanket. So it's quite
just on my phone.
The other thing I got is one of those lamps. It's like a lamp alarm clock which mimics sunrise. Which is
Lumi.
It's a Lumia.
And
it's brilliant. The only downside is you can set it to come on to noises, and one of them is like bird song, which I really enjoy. Apart from when you stay in the hospital accommodation here at like 3 a.m, I'm now tuned to wake up because the birds are so loud. I'm like, it must be time. So it has its downfalls, but I think it is quite a good tool to have anyway.
I got one for Christmas this year, and it's actually fundamentally changed my sleep practices, and I recommend them. And I wake up now before the alarm on it goes off, and
it's a natural, like, it is actually a very natural way to wake up. And I don't know if it's just placebo effect, but I certainly feel more rested.
Well, it was actually came out of a conversation I was having with a number of other acute medicine trainees, and we found it quite helpful in that period you were talking about, transitioning out of nights and days. So I guess our final bit really is about the shift patterns, because you won't have done shifts like you'll have been given a rota pattern now, and that's like, so I've been doing a rota pattern since 2006, and I don't really think much of it now because that's how my life is. But when you start, it's actually a big shift. It's quite intense. I think, and you will end up working quite a lot of hours. And that's why it really is important to make sure that you're getting good sleep, you're doing stuff outside, because it can be very easy to just become completely absorbed by work. And I found it quite tiring. Like, that's the other thing, they're long shifts, and being mentally alert for 12 and a half hours can sometimes feel like a very tall order. So making sure you're well hydrated, you're eating, but also just recognising that will take a while to get used to, because, well, depending on what you've worked and don't be afraid to have your break and have a nap. Actually, the evidence that we should really be pointing to is you should be taking a break, and if you can possibly have a sleep, get some shut-eye. 20 minutes to half an hour if you can. Power nap. And there is a benefit in the it's why we call it the power nap. But it is difficult to do because you'll kind of feel on high alert when you first start. I don't know very many foundation trainees that I work with on nights where I'll say, just give me a bleep and go and have an hour, that's fine, things are quiet. They're invariably they don't sleep, do you know? And but if you can,
some people are better at napping than others.
I'm good now. Taken me years, but I think I've realised, because I have kids that I go home to and that kind of thing. So, and they're only in school for 6 hours, so I really need to protect how I manage my night shifts and my sleep. Whereas when I was younger, I think my sleep was much worse because I kind of felt like, I've got 12 hours now. You actually have to be mindful of it. But I really would promote the other podcast by Mike Farquhar.
It sounds good.
It is.
Is it on the website?
It's on the RCP, and you'll be able to find it via our RCP COVID Conversations podcast. So signpost to that. So we'll put some links of the apps we've mentioned through this. I hope you found it helpful. If there are any topics you want me to discuss with Felicity in further detail, we're more than happy to do so. But I hope this gives you some pointers and some confidence in starting these early assistantships, and I guess a big thank you for the guys that have put themselves forward to come and help during the crisis, and we promise we'll look after you.
We'll try our best. Offer a lot of support. And good luck.
Good luck. You won't need it because you've had 5 years of training and 6 years in lots of cases, and actually, you feel every change is difficult, but actually you've been prepared for this. You've got this. You'll be fine.
Absolutely. Okay.
Right. Thanks, Liz.
No, thank you.